The US government has dropped clear daily limits on alcohol consumption in its newly released 2025 to 2030 dietary guidelines for Americans, marking a major shift after decades of fixed recommendations. For the first time since 1980, the US federal guidelines no longer tell Americans to restrict themselves to 1 or 2 standard drinks a day. Instead, the updated advice urges people to drink less alcohol for better overall health and to limit alcoholic beverages without setting numerical caps. The new guidelines also remove earlier warnings that alcohol increases the risk of breast cancer and other cancers. Earlier guidelines had cautioned that even moderate drinking could raise the risk of cancer, cardiovascular disease, and premature deaths. These guidelines often shape medical counseling, school meal programs, and public health policy across the United States. In fact, health researchers have long used the government's drinking limits as benchmarks in clinical studies. And to define moderate versus heavy drinking, the revised guidance does advise the certain groups to avoid alcohol entirely, of course. And that includes people who are pregnant, those with alcohol use disorder, and individuals taking medications that interact with alcohol. It also tells people with a family history of alcoholism to remain mindful of their drinking and addictive behaviors. But the guidelines do not separate recommendations for men and women, despite differences in how they metabolize alcohol. They also do not include a specific warning against underage drinking. And this policy change comes as alcohol use declines across the United States. Very interestingly, a Gallup poll showing only 54% of US adults now say that they drink alcohol, down from 62% in 2023. And more than half of the Americans also believe even 1 or 2 drinks a day harm health. More than double the share who held that view in 2011. To stay up to speed with the latest news, download the WION app and subscribe to our YouTube channel.